So, got my PPE on, scene safe. Got a call for female with chest pain, one patient, and I'm going to request the assistance of ALS. Going to consider C-spine, but probably won't have to use it. Hi, my name is Kyle. I'm an EMT. What was your name?
Debbie.
Oh, how can I help you today?
Well, I started to have some chest pain a little while ago.
Alright, chest pain. Alright, sounds good. So my general impression of the patient is that she was answering my questions, following me with her eye movement, is alert and conscious, responds to my verbal cues, was warm to touch, and she told me she had some chest pain, so chief complaint of chest pain. Is it okay if I listen to your chest now?
Yeah.
Nice. Take a deep breath for me. Okay, one more. Okay. Breathing sounds good. And check your respiratory rate. Would you breathe normally for me? Alright, that's at 15 breaths per minute. That's good. Not going to put our patient on high flow O2 because breathing is normal and regular. The patient has no major bleeding or active bleeding. Check the pulse now. Can I check your pulse, please? First. Right there for me. Dang, slow pulse. So pulse is 56. Temperature of the skin and skin color is normal. And I'm going to make this patient a priority patient and recommend transportation immediately. So about when did your chest start hurting?
About 2 hours ago.
About 2 hours ago. What were you doing at the time?
I was working out in the yard, doing some yard work, shoveling and stuff.
Of course. Does anything make it hurt more or less? Turning, rotating,
No.
breathing? Any pain with breathing?
No, it's kind of hard to breathe, but it doesn't hurt.
What type of pain is it? Is it piercing pain, the crushing pain?
It's like a pressure, a squeezing on my chest, kind of like something sitting on my chest, like a weight.
Okay,
And it's kind of right here too.
Okay, it radiates out to your shoulder.
Just right here.
Does it move anywhere else?
No.
All right. On a scale of 1 to 10, 1 being just any average day, and 10 being the most pain you ever felt in your life, what would you rate this as?
Maybe an 8.5.
8.5. All right. And then you said it started 2 hours ago. Has it gotten worse or better throughout then?
Well, I thought it was going to get better when I rested, but then it didn't. It still is hurting just as much.
Okay, so you're working out in the yard and then started hurting, so you took a little rest?
Yeah, but it didn't get better.
Alright, do you usually do this kind of thing, or is this like a...
Yeah, no, I work out in the yard a lot. It usually is fine.
Okay.
This is the first time it's hurt me.
Of course. Do you have any allergies to medications, food allergies, anything like that?
No allergies to medicines, just poison oak.
Just poison oak?
Mm-hmm.
Alright. Any medications you're on currently?
I have high blood pressure, so I take amlodipine and hydrochlorothiazide for the high blood pressure.
Okay. What's the next one? And do you have any history of this, or this has happened in the past?
It's never happened before. There's some history of heart disease in the family, my dad, but
Okay.
I haven't had any.
Of course. What was the last thing you ate?
I had breakfast a couple hours ago.
What did you have for breakfast?
This morning. Oh boy, I don't know. Eggs maybe? I think I had some eggs.
Oh, okay, of course. And then, what were you doing before this happened? You said you were working out in the yard. Anything before this change of schedule or anything like that?
No, not that I can think of. I didn't get very much sleep last night.
Alright.
So I just was a little tired all day.
Of course. So at this point I would want to expose the affected area, look at the skin, check for any rashes or discoloration, tenderness, palpate the area, look for anything like that, swelling, bruised areas. Is it okay if I take your blood pressure?
That's okay.
Your right arm, please.
All right.
Yes. Just relax. (125/80). So that's good. Blood pressure's good. I can take your pulse again. Thank you. Pulse is 60. And pulse is 60, strong and regular. And then I'll check your breathing again. Is it okay if I check your breathing first? Would you put my hand on your chest? Respiratory rate of 9 breaths per minute. And strong and regular. Patient had chief complaint of chest pain. Vital signs are all good. Still recommending priority transport. I had no interventions except for checking for blood pressure, heart rate, and respiratory rate. I'm going to reassess this patient every 5 minutes by looking at the affected area, checking for discoloration, rash, swelling, bruising, anything like that. Also retake of the vitals, blood pressure, heart rate, and respiratory rate. Alright, so my report is that this is our patient Debbie, 48-year-old female. Chief complaint of chest pain, started about 2 hours ago and got progressively worse, now up to 8.5. Only radiating into her shoulder, no provocation, doesn't hurt when she moves or breathes. A little bit of labored breathing. She reported difficulty breathing. No reported allergies to medication or food. She is taking some high blood pressure medications, amlodipine and hydrochlorothiazide. She has strong vital signs with a blood pressure of 125/80, pulse of 60, and respiratory rate of 9. Both the pulse and the breathing were both strong and regular. I did no interventions except for taking vital signs. Our patient had no past medical history of anything like this. Does have heart problems around the family. The patient was gardening when she first felt any pain in her chest.